Welcome to By the Numbers, a public health podcast where we break down issues that shape the health of our communities one data point at a time. I'm your host, Addie Olson with the Polk County Health Department. And today I attended the annual Housing Symposium that's put on by the Polk County Housing Trust Fund. And I'm grateful to be joined by the keynote speaker from the symposium, Dr. Stephanie Ettinger de Cuba. And Stephanie is the executive director of Children's HealthWatch and a research associate professor with the Boston University School of Public Health. And your work is in addressing social factors that really shape the health of families and children and communities. And you made some powerful connections today between housing and health. So I want to talk about that. And thank you for joining me today.
I'm really glad to be here. Thanks for having me.
And can you talk a little bit about your work and your background just to start us off?
So background, I'm a public health person. I sort of truthfully fell backwards into public health. I didn't really realize that was what I wanted to do until kind of later in the game. I knew I was interested in kids. I knew I was really interested in different languages and cultures and in nutrition and health, but not clinical health. And I just couldn't figure out how to put it all together. And then I actually was in the Peace Corps and worked on some public health projects in the Peace Corps and was like, this is where it's at. This is puts all those threads together and landed up in public health. And then I did a lot of programs, sort of outreach oriented work, and honestly got to talking with the person who sat next to me, who was the director of policy. And she started asking me to help her out on things. And I was like, oh, policy. Wow, look at this. This is really cool. So between the public health piece and then working on policy, I ended up navigating myself to this sort of intersection of research and public policy, and specifically thinking about young children and their health. And so I've been for a long time now working with the team called Children's HealthWatch, like you said. We are a nonpartisan research and policy network that's based in Boston, but we have research sites in 4 cities. And we're focused on the health and development of very young children and the well-being of their families and the ways that changes in the economy and changes to public policy impact their health and development.
Awesome. Thank you.
Yeah.
And you did a fabulous job today speaking at the event and made so many great connections between housing and health. And I want to get to all of that and condense that into one podcast episode, hopefully.
We'll try.
Yes. But can you give us just like the why behind your work, like why you do the work that you do and why it's so important to you?
Yeah. So I think some of it comes from personal experience. Some of it comes from the sort of public health orientation that I have. But really, I think the foundation of all of our lives is the environments that we live in, and we don't live in little silos and little boxes, right? And so one of the things that's really kept me working on these issues is all the interconnections. And so much of our policy gets made in like housing without consideration for healthcare without consideration for housing. And yet that's not how we live our lives. And that's not how children experience the world either. And so, the team and I were a very interdisciplinary team. I'm a public health person. We have pediatricians. We have child health policy experts, pediatric psychologists, like all different types of skill sets and backgrounds, somebody who's a communications expert, and all working together on this because I think we all see the opportunity to change policy and make it evidence-based and really help policymakers at the local, state, and federal level understand the implications of the decisions that they're making, whether that's a proposed policy and we're helping them understand the consequences that are going to be happening from that, or trying to help them, in the best of cases, we're trying to help suggest tweaks to policy or new policies that will make things better for families and help them to afford all the things that they need in their lives. And housing is really the foundation to all of it. If you don't have housing, you don't have stable housing, it's really hard to be thinking about, getting a good job or focusing on your education or being the parent that you want to be. I think that's one of the powerful things that when we've done qualitative work, so like, more interview style versus like a survey, talking to parents, and when they're able to stabilize their housing, they're able to be the people that they want to be. But if you're worrying about where am I going to sleep tomorrow? Am I going to be able to keep this roof over my child in my head? It's really hard to be like, let's sit down and engage and read a board book together, So it just makes that so much harder. The stress level is so much higher. So I think work on lots of different issues, but for me, and for all of us, I think really at Children's HealthWatch, housing is a really foundational piece of that.
I like that framing. Housing is the foundation. And like you're talking about, you can't thrive if you're not meeting your basic needs. So many families are just living in survival mode in our community.
Absolutely.
And one data point that you mentioned today stood out to me. And it's that young children and families who move frequently or are behind on rent are 20% more likely to be hospitalized than other kids. That's just one point that you made. But across the board, kids who do not have access to safe, stable, affordable housing have poorer health outcomes. Can you talk more about why that is?
Yeah, for sure. So, I think it's lots of different factors feeding into that, right? But if you're struggling to pay the rent, you're behind on rent, or if you're moving multiple times, like when constructing that measure, sorry to get a little nerdy here for a second, but I think it's an important context that, we saw that one move in the space of the year could be a really positive thing. Maybe you're moving to a better neighborhood, you're moving to a bigger apartment, you're moving to a place that you can afford more, whatever it is, right? So that could be a really positive thing. But if you're now moving twice in a year or more than that, that's an indicator of that you're unstable, right? And perhaps you're, perhaps you were threatened with an eviction, you're struggling to pay the rent, you lost a job, or, housing quality is a problem. You're trying to move to get away from that, whatever it is. So that kind of, I hope, helps paint the picture of who those multiple movers might be. It tends to be a relatively low percentage of families, but it's a really toxic situation if you're having to uproot yourself repeatedly within the space of a year. So, and then so for both the folks that are behind on rent and those that are moving multiple times, those are sort of indicators of other kinds of stresses, right? So if you're struggling to pay the rent, then you're probably also struggling to pay for other things. So maybe you're cutting back on food because nobody's knocking down your door with an eviction notice or a shut-off notice because you didn't, buy all the groceries that you normally buy, right? So that tends to be the first thing people squeeze when they're struggling to make ends meet, is they drop the quality of the food, and then soon after that, if they can't make ends meet still, then they drop the quantity of food. And parents will sacrifice eating or their children. So they'll go without a meal. You hear all kinds of stories about, well, I just go to the bathroom while my kids are eating so they don't have to watch them eating because it's really hard, or I just eat whatever is left over on their plates when they're done. Parents will go to pretty extreme lengths to protect their kids. And when it gets to the level of parents having to restrict the amount that kids are eating or having kids skip a meal, things are really stressed in the household. And that is super tightly interrelated with being behind on rent and also multiple moves. So just that, and setting aside anything about being able to afford utilities and keeping your home at a comfortable temperature in the winter or a comfortable temperature in the summertime, which also are health stresses if you're too hot or too cold. Just the food piece, we know that actually puts kids' immune systems at risk, right? Like your immune system isn't able to function optimally if you're not getting the quality of food that you need or the quantity of food that you need. And that just sets off a cycle, right? So then you're more susceptible to every passing cold and infection that comes by. And you might recover from that, but typically with those kinds of things, kids might lose a little weight because they lose their appetite when th're not feeling well, right? But in a family that has enough resources, the kid eats double or triple for the next 2 days or something like that and quickly puts that weight back on. But in a family where those resources are restricted, there is no double and triple. And so then you're now at a lower base point, right? You've started circling the drain a little bit. And now you're compromised in an even more severe way. And then the next cold or infection or whatever else comes along, or you're in a poor quality housing, that maybe there's pests, maybe there's cockroaches, maybe there's mold that affects your kids' lungs. They're more susceptible to it because their immune system isn't functioning at optimal, function. Sorry to repeat. These things start to cycle and cycle, and that's how kids end up hospitalized, right? Because there is no recovery because the family doesn't have any. There's no stretch. There's no nothing else to bring them back, it's all these things interrelated with one another. And I think stress is also a big part of it, right? So especially when children are very young, but throughout childhood, parents and kids are kind of symbiotic, right? If a parent's not doing well, the kid's feeling it, right? The parents may try to hide it, but the kid is feeling it. They'll feel that stress in the household, and that gets passed on as well. And, if there's a potential eviction, or they know that, that mom's worried about whether we're going to be able to stay here next month or all that kind of stuff, that atmosphere gets passed on. And I'm not trying to blame parents in any way, shape, or form. That would be an incredibly stressful thing for any parent. But that sort of chronic stress also eats away, also makes us more susceptible to poor health and frankly, mental health as well, right? So we have parents that are feeling depressed, anxious. That actually affects child development. There's lots of studies demonstrating that maternal depression is a risk factor for kids having a developmental delay. And some of it is what I was saying before, of not being able to be the parent that they otherwise might be, not being able to get on the floor and play with a kid and have that sort of like back and forth that is the optimal relationship for child brain development. So, sorry to go on, but I think there's all these tendrils to it that aren't immediately apparent on the surface.
Thank you for making that link. And I have one number from your presentation earlier about children who have experienced evictions. So children who have experienced evictions were 55% more likely to experience developmental risks to that point.
Yeah. So I think some of what I just said is relevant there, right? That the stress of an eviction means that the parent is like in this stress mode and really, not able to have the patience that they might otherwise have with their child and allow the kid to explore and to have that, what they call it in public health or in child development is called serve and return, like tennis, if you think about it. Like that's how kids' brains develop, is I talk to you as my baby, you babble back to me, then I talk back to you. And that's how kids learn language. But if the parent is so stressed, they're not sitting there doing that back and forth with their baby, right? That's just their mind is elsewhere, understandably. And so actually that can affect children's brain development, and they literally don't grow the same brain connections that a kid whose parent is less stressed is able to grow. The other thing about it is, for young children to learn and also for their brains to grow in the way that they should and develop in the way that they should, they have to be exploring their world, right? Everybody's seen a toddler, like they have to touch everything, right? But like toddlers learn by touching, learn by doing, right? And so if you are now having to leave your apartment and go live on somebody's couch, and they're like, you can have this corner of the living room, no further, then you're constantly worried about like my kid wandering off, right? So you're restricting the child's movement, but also brain development. Same thing in shelters. They've shown that kids in shelters, especially, and particularly ones where we've had kids, having to live in temporary situations like hotels and things like that, that those kids actually, the youngest ones are not developing at a normal pace, and older kids are struggling in school and that sort of thing. And part of it is simply the environment. I know a pediatrician friend of mine was talking to me about a baby that she was caring for, and the mother was really worried about the baby because the baby kept crawling in circles and wasn't crawling like outward. And long story short, and like, talking more with her about it, and just like the kid didn't seem to be developing normally. Well, they were living in a hotel, and the floor was really dirty in the hotel room. Like, it wasn't a properly maintained space. Not the mother's fault. Like, the hotel was not, and motel was not maintaining it properly. Floor was really dirty. The mother didn't want the baby crawling on the floor, so she was allowing it to crawl on the bed. So how big is a bed? Circling the bed.
Yeah.
Right? So, I mean, it's all these like little things that you wouldn't necessarily connect, but have a long-term consequence. Now, all that said, I want to say children are incredibly resilient. So I don't want to say that these early effects aren't remediable, but, it's like the difference between a well-oiled door and one that's creaky and rusted. Their hinges are creaky and rusted. It's a lot more work to open a creaky, rusted hinge than it is to open a door that has a well-oiled hinge, right? So we can get there, but the investment of resources is so much higher. And so, in my view, public health view, why don't we just start with investing the resources and not have to deal with the creaky, rusted hinges in the first place? Like, let's just make it so that kids can learn, kids have the environment they need.
Seems like a natural place to start. And as the mom of a toddler, I know one thing that toddlers love to do is put stuff in their mouths. And so beyond some of the space confinements that you mentioned and that effect, if you're living in a house with lead paint that chips off,
Absolutely,
for example,
yeah.
or mold or pest infestation, a number of things, there are other risks there too.
Yeah, and I think one thing, I did a study a couple of years ago and spoke with a mother who told me that her child had very much exactly what you're saying, had eaten lead paint chips in the apartment. It was the apartment she could afford, and the landlord wasn't maintaining it. But she was terrified. Another speaker today talked about kids who are involved in child welfare. She was terrified that someone would take her child away from her. And so even when the test came back with the high lead level, she didn't go back to the doctor because she was terrified that they would deem her to be an unfit mother, that she wasn't taking care of her kid. And so she didn't go back, and they didn't deal with the lead level. So I think there is, there's not just stuff in housing that we need to deal with, but there's other stuff in other systems that make it punitive so that people aren't willing and able to seek the help that we want them to seek because they're afraid, right? They're afraid of being painted as an unfit parent and having that child taken away from them. So I think we have to think broader when we're thinking about policies. And again, sort of going back to the beginning of the conversation, like the ways that policies interact with one another, and not be thinking of just like child welfare over here and housing over here. They're very much intertwined.
And I want to talk about like how we do think about that together, but I have to give a quick plug to our lead hazard program at the Polk County Health Department. So if your home was built before 1978, I believe, we know that lead is a great possibility, and we have an older housing stock here.
Yeah.
And if you have a child who is under 6 and who either lives in the home or visits the home frequently, and you have lead in your home and you meet income requirements, we will come out and fix those lead hazards for you. So just want to make sure that everybody knows about that program.
That's amazing. That's wonderful.
And when you go back to your point about we cannot look at these things as separate issues, and we need to be thinking more holistically, maybe?
Absolutely. 100%. Yeah, I think that's, so one of the things that I loved about today was there were people from all kinds of different pieces of this world in the room. And I think we need more and more of that because we have to be talking across silos, because what I know in my little space, you might know something else in your space, and I will never know that unless we talk to each other, right? And so if I make a decision here that's going to impact you, I need to have thought about that ahead of time, and we need to have talked about it, and I need to design my policy in a way that's not going to harm what you're doing or, harm the people you're working with. So we can't know everything, right? But the only way we get to designing things holistically is like that cross-sector collaboration. It's just absolutely essential.
Which I really appreciated about the Polk County Housing Trust Fund's Housing Symposium today. Like you said, just a ton of different minds in the room from different areas in the community, and having everybody come together to get on the same page is really helpful in going in the same direction.
Yeah, absolutely. Yeah, vital.
All right. Well, any final thoughts that you want to add to our conversation today? Maybe a big takeaway on how we can move forward in creating healthier, safer homes for healthier, safer kids?
Well, I think two sort of big picture items. One is early investment pays off, and that really thinking the long game, which is, I know, harder in politics because it tends to be like the next election cycle, but I think the more we, all of us who are working in these areas in public health and housing and in healthcare, can work together to like really document and demonstrate the long game, that when we invest early in children, that we're making a healthier adult for their whole lifetime, more, somebody who's going to be able to have success in school and work and do all the things that we want them to do, that we're actually helping our whole community by doing that. So I think it's number one. And I think also getting creative with our policies, not thinking beyond what we are currently doing. I know I talked a bit about guaranteed income today, but like the flexibility that kind of benefit provides to stabilize people in housing and also allow them to meet all these other needs that are, again, like we've talked about, intertwined needs, is also vitally important.
Yes, and there was a great pilot here in Greater Des Moines. I think it was called Uplift.
Correct, yes.
And we looked at what providing people universal basic income does for individuals in our community, and the results were pretty stunning. So I would highly encourage anybody who is interested in learning about that to look up the Uplift pilot, check it out. The Mid-Iowa Health Foundation was really instrumental in implementing that here in our community.
Yeah. Fantastic pilot. Looking forward to hearing the final results. I'm sure they're going to be really impressive.
Absolutely. All right. Well, thank you for joining me today. I really appreciate it and was so glad to hear from you at the symposium today. And just wanted to give another plug to the Polk County Housing Trust Fund. Be sure to check out all of their doing in the housing space on their website, on social media, and stay tuned for future episodes of By the Numbers by visiting buzzsprout.bythenumbers.com or listening on your favorite podcast platform. Thank you.